Hi, I'm Amy McClanahan from StableLab, and we're here in Las Vegas on the eve of AAEP 2015. Right now, there is a shift happening in equine blood testing, and it's driven by the Innovators Circle, a small group of world-renowned equine veterinarians who are here tonight to discuss the progression and strength of horse-side blood testing and the undeniable impact it is having on how they use antibiotics. In the next 20 minutes, these veterinarians are going to reveal and share their learnings and experiences in this industry transformation.
We're here to try to, share experiences with not only with ourselves, but with the practitioners that are watching. But it's something I still have problems with. I still do to new clients. What is your go-to argument? This is up for grabs, this question really, on how you tell a guy you want to use or a person you want to use this expensive test or not expensive. It's expensive because they don't know what it is, right? Anything's expensive.
Have you tried the "Trust Me, I'm a Doctor"? Did you?
On the racetrack? No, I haven't. I haven't. I usually
to start with, Louis, is just start with a CBC and maybe a CBC fiber engine. With a lot of people, that is, that's where they're naturally going to go if they've got a question, infection, no infection. So start with that. But get them to add a more dynamic component to that CBC fiber engine picture by adding the serum amyloid A in there. It's like everything when we first started using it, the more you use it, the more you begin to understand it and you understand where it fits in the clinical picture. But that's what I explain to most of my referring veterinarians is let's start here.
Now I'm in a field situation, so I'm absolutely the opposite. Let's do an SAA while we're waiting for our CBC to come back tomorrow. Excuse me. And so, here I have a test looking at your horse that's not right or sick, or we have a question, and we'll do a CBC for sure, because I do think that gives you different information. And we were all talking earlier about, that change in white cells, lymphocytes, monocytes, those are important things. I don't think we need to throw those out, but that SAA tells me now when I'm at the farm with my client standing next to me, they want to know what are we going to do. And that's where it's helpful for me because I don't have the luxury of a clinic.
And I think it doesn't just tell you what are we going to do today at the start of the question, but it tells you what are we going to do 5 days from now, or it helps you decide 5 days from now. So because it's such a much more dynamic value that we're getting, I think our professional decision making also becomes more valuable because we're able to make those decisions earlier. And so that's the real value, I think, to the client.
Our clients might be owners or trainers, or our clients might be other veterinarians, and I think the questions and the sort of discussion about why it's useful are probably a little bit different. One of the things that I hear, for example, from a practitioner is, I don't think I could use enough of those to make it worth my while. And to underscore what Rob said, the more you use it, the more you learn how you really can use it and how useful, and you come to rely on it really pretty readily. And so for many of my clients who are veterinarians and sending me cases, that's what I tell them. I think if you will get yourself a 25-pack, I'm asking you for it now, but I'm going to keep asking this, and pretty soon you're going to find cases that you're going to really go, wonder what his SAA is.
I wanted to talk about the use of SAA in foals. And I know, Bonnie, you're using a lot in screening of foals, is that correct?
Well, not necessarily in screening, but just foals that, in my practice, as I'm at a referral hospital, I see a lot of newborn foals. They come in for pretty severe problems. And I've noticed that if they come in and they're septic or have some pneumonia, and this is a young foal, their serum amyloid A's are really high.
And Phoebe, have you been involved in more of the screening aspects of it?
I have been. In that some of the farms that I work with, that again in an internal medicine capacity, but The first opinion will have me see all of their foals in the first 24 hours of life. That's a sort of a contract we have, I say certainly. And I've utilized serum amyloid A from StableLab on those foals as part of my protocol, as it's a markedly more sensitive indicator of infection than either the white count or the fibrinogen. So every foal that I see has an IgG, a CBC, and an SAA. To be honest, I've sort of dropped off the fibrinogen in large part because I can run an SAA, and that's really gives me the answer that I'm after. In the screening foals, in the first 24 hours of life, how are we doing here? This is just healthy foals. And I see a couple hundred newborns a year in the first 24 hours, and I've found it to be invaluable in screening those foals. Sometimes I might get just a hair low total white count. If I have a normal SAA, and in foals, that number is going to be a little higher, what is normal. Something closer to about 100 might be normal in a healthy foal, then I'm okay. If I have a slightly low white count and an elevated serum amyloid A, that's a different picture. We're going to be on antimicrobial therapy.
So, and Chris, have you been monitoring rhodococcus or strep or?
Strep equine.
Strep equine.
We had a outbreak, so to speak, last year. And so we had the luxury of running as many SAAs as we wanted to. So it was very helpful. It changes so quickly that that's one benefit that we had. But really, of the ones that we could document externally, within 24, if you had a spike, we ran them daily. And if you had a spike, within 24 to 48 hours, you can guess that you would see an abscess. So we kind of used it to see where we were going. Are we going to get more abscesses? Do we think this is the last abscess we're going to have? So I don't have huge numbers, but we had enough that I felt comfortable. The hard part was if you had a spike and then didn't see an abscess externally, we assumed, whether right or wrong, that we had one internally. So that changed our therapy. That changed our idea of therapy anyway.
And I remember last year you mentioning you weren't sure what number was important to you.
Well, I've learned that 100 is what I shouldn't worry about, but in neonates.
Yeah.
But I have tried to use the 30 rule, but I did take something from Janheim for this last year. I really did use it. I was more judicious about using antibiotics, and it really helped. I think there were plenty that I'm sure I started too quickly, but I did try to watch, wait, put other signs in there. Do they have fever? Are they really sick? Or those things. So it helped me that way too. We ran on all of our babies. We did ran the same test that Phoebe ran, and we did get a lot of zeros. We had a lot of zeros. If those babies had anything above a 0, I reran it periodically.
Same age as?
Newborns.
Yeah.
They were newborns, because the exact same test we ran on ours. So I didn't really know how to interpret it, but if they weren't 0, I started running serial tests every 24 hours. And we'd just watch them. I didn't inherently, though babies that had 30 or 40 or 50, I didn't inherently start them on antibiotics, and thank goodness most of them didn't need it.
Now, we'd like to talk about monitoring response to antibiotic therapy. And I wanted to talk to Bonnie about that specifically, or begin with you. How has that helped you? How has SA helped you monitor infection? And maybe if you could talk a little bit about the use of antibiotics in general.
I think, first of all, just monitoring the response to treatment, to antibiotic therapy, it's been very helpful. Oftentimes you'll have an elevated serum amyloid A, you'll start the patient, you'll diagnose your infection, you'll start them on antimicrobials, and then monitor them clinically, but also, at least in my hands, I'll utilize an SAA, and as they're responding favorably to treatment, I'm going to see a drop in the serum amyloid A value. And there's been probably quite a few cases that I've actually stopped antibiotic treatment sooner than I may have if I didn't have that test to look at. And I think as for the overuse of antimicrobials, I think that's something that hopefully with this test, people are not using antibiotics as much as they may have previously. A horse has a fever, maybe have just shipped in, you run a serum amyloid A and you might see a mild elevation, and instead of just grabbing the antibiotics, hopefully you can just continue to monitor the horse, and the horse could take care of the infection itself, and you wouldn't even have to start it on any antibiotics.
Yeah, I agree. I mean, that's my biggest fear, and the problem is the impending colitis. And Rodney, I know that that's a concern of yours, and you see that in your clinic as well.
Yeah, we see quite a few in our practice, and I've started monitoring the SAAs in a lot of these cases, and as the inflammation starts subsiding, or at least I perceive that the inflammation is subsiding, the SAA certainly seems to come down. And where it's really helpful is in those cases where we have horses that develop secondary complications, either secondary bacterial or fungal pneumonias due to bacterial or fungal translocation from the gut. So, the SAA will start coming down, but all of a sudden you get a spike. And, it's been pretty reliable in, obviously with that spike, you're going to get a fever spike as well, typically. But it's been very handy to see the SAA go back up in hand with, the horse, spiking a fever after it's been afebrile for a couple of days. So yeah, it's been very useful in that sense. Yeah.
I wanted to talk about, Philippe, about pre-competition or pre-testing. Is that changing internationally?
Well, internationally, I would kind of stick to what Richard said. The new thing I came up with, my client just bought a CBC machine and biochemistry, and this is kind of a fancy tool to have. So following up 15 horses, going on the different shows. And I must say the CBC has been kind of frustrating compared to the SAA. So when the horse is a bit like dull, not exactly where it should be, things, we get to know the horses better and better as we show, a bit like Janheim, when you just follow a team, you know how the horses should behave. And the grooms know also the horses pretty well, so you can be upfront problems. So each time we have had a horse who's just a bit down, maybe not having exactly the same appetite, just pull the SAA, sometimes find like 150, 200, which is my limit to me. I mean, I can hear everyone coming up with numbers. And I guess it would be good actually to come up with a number where we all kind of agrees for the people who are watching us. The reason was that these horses come with a completely normal CBC. Maybe 24 hours later or 48 hours later, they might come up to have an elevated white blood cell, or actually a decrease and increased lymphocytes, which is interesting, but I didn't have so many like this. The ASA has always been upfront. The main problem I am actually figuring out today is that the other competitors, when they see me doing all my tests, feel a bit jealous, so I get a few claims to the jury that I am not supposed to do that. But beyond that idea, you know, the FEI, if you make a few remarks and you do something for the welfare of the horse, at some stage it should not be prohibited. So I will try to push this forward because I think it's a great thing to do. And like if you go for a race, maybe you have a horse who has a kind of a strong schedule, maybe you want to pull up the lactate, pull up the SAA after race and say, well, is this horse supposed to train again in the next 3 or 4 days to go to another group 1, group 2? Same for your horses who may actually show more, I mean, on the Western performance horses. But the show jumping, you know, the schedule is pretty strong. I mean, some horses do 20 shows a year, which means 20 weekends a year. 20, 25 sometimes, plus championships, which means showing every day for 4 days in a row. So on these other cases, what I do is use the SA as a pre-shipping test, only if the horses are going to ship more than 8 hours. So in the US, it happens quite often. In Europe, more and more when they have to ship one way or the other or fly. Because if a horse is not right, then you can maybe say, you know, maybe it's not going to go, or you're going to maybe, like in Germany, we used to do antibiotics before they fly. It was very, very common. We used to do doxycycline at that time. Yeah. Nowadays, we just don't use antibiotics anymore as a prevention. which I guess was stupid anyway, and the horses would still have some issues, and then you would have to put them on huge amount of probiotics. And so maybe the SAA, again, in that field, once we kind of collect more and more numbers, more and more samples, we might come up with guidelines.
I just wanted to ask a question. How have y'all incorporated, what I'd like to be able to do is before we ship horses, I know y'all have already done this, I don't really know how to interpret if they've got a 30, remember how we talked about 30 last year? So if I've got a load of horses that are going to go to a barrel race, let's say 8 or 9 or 10 or 3 hours away, and we run it as a screening tool, I don't have a value in my mind that I should say, no, I don't think you should go. Are y'all using it pre-race? Are y'all using it pre-race on the track?
We don't use it routinely pre-race. We will sometimes use it after we scope a horse in their last work prior to a race. So 5 to 7 days before that race, if we see mucus in the trachea, then maybe we'll do an SAA to determine that's the fork in the road point. You know, is this small airway inflammatory disease? Is this some sort of impending infection? And that's when we use it, but we don't routinely test it pre-race.
Lewis, do you?
Beginning to do it a little more, but I do use it pre-shipping. And, you know, the clients that I have using it as a pre-shipping tool is not an emergency to get this horse down from, you know, the Mid-Atlantic or New York down to Florida, for example. They just have to come down eventually, today, tomorrow, next week. So it's not a critical thing. They're just coming down for the winter and training. It's not like I have picked out a race or something like that. So I've had many that are 30s, 50s, 100s that I didn't treat, but we talked about that earlier, that I just tell them to retake it the next day and just see a trend. I just want to see the trend. For me, the slope of the curve is as important as what the number is. I've been very happy looking at numbers that are higher than it was yesterday, but the slope has totally changed.
SAA to me is a tool, like my stethoscope, like my thermometer, like my CBC, it's a tool. So if I look at that horse, it's 200, and he's coughing or poor performance, I'm going to be much more aggressive about jumping into therapy. Versus if I look at him and everybody's going, he's fine, he just bucked me off. And in that case, yeah, then we can do it. Now, interestingly, we went, when we were setting this study up, we talked to Fairfield, and Fairfield said, you know, I'd like to see you do it at day 0 and then day 2, because you're going to get in that window of when they're going to produce some SAA and whether you're going to be getting into some infectious components to it. So, you know, for me, I'm with you. If I have that 250 and I'm worried about that horse, I'm doing it every day. And the value of that test, I think, is remarkable for our clients, because regardless of what the cost of the test is, either to be able to start therapy earlier or delay therapy that's unnecessary, the value, it's not really what the cost is, it's what the value of that is. And that's a huge change in how I'm approaching that case. I think the challenge with some of these cases, and when we're looking at trending, I think was your initial question, I'll do them every 48 hours. That's for me just in the trending in an active inflammatory thing. So I think, to me, some of the challenge when you're saying, you know, how are veterinarians accepting it, I really find it, you know, I was certainly skeptical. I certainly had a challenge getting it into my practice culture when I started it. Now it's easy. It's in the front door of my truck. And any questions. I'm not doing a lot of colics because I get confused on what that's helping me with. I let Nick do them when they go into his clinic if they get that far. But, you know, for any of those infectious performance, inflammatory versus infectious, those are really important. And I think you made also a good point, and probably you internal medicine people would be better to talk about the post-vaccination SAAs. I think that's really important. Don't be confused by that.
Yeah, it's an important point. I was lucky enough. I needed to find out, so I had a bunch of ponies, racetrack ponies, what they call ponies, and we vaccinated them. And I took SAAs every hour on him, and saw the first response in 6 hours.
Okay, well, that's good to know.
From we used Vitera 2XP specifically.
And you had time zero.
I had time zero,
yeah.
and then every hour, and then it went all the way through 24 hours. I
Cool.
lessened the thing, but I only had 6 horses or something.
Yeah, I think it's predictive value. Definitely makes it so valuable to the client. I know in a hospital environment, it's extremely cost effective, and especially with the unreliability of a CBC necessarily, or the fibrinogen being as predictive, we can cut costs by not doing CBCs or that kind of blood work as frequently, but the SAAs we can keep up with more frequently, and I think that's a very high value for the horse, the client, and overall, I think it's very worthwhile, that information, especially for how cost effective it is.
Do you find that SAAs have stopped you from taking a horse to surgery more so than, say, an elevated white count would have,
Yes.
prior to the advent of SAA?
Yes,
Yeah,
definitely. Because
yeah.
I mean, especially on your sort of 1 and 2 year olds, there's definitely a number of horses that'll have mildly elevated
Exactly,
white cell counts
yeah.
that you still go to surgery because physical exam findings, et cetera, are the same.
Yeah.
If it has an elevated SAA as well, you're not going to be going, and so
Right.
and those are the cases that are going to stop you running into big post-operative complications and spending more of the client's money on things that you could have prevented ahead of time. So,
And Jan, I think you've used it a lot for. Have you used it for pre-surgical screening?
Both pre and post-surgical. We do a lot of surgeries on young horses, arthroscopies as cosmetic surgery, so to say. It's a breeding area as well. So those horses that come in are away from the farm the first time. And the surgery is a lot of stress. And as I said before, we don't use antibiotics as a routine. We do not use them. So on arthroscopies and even on castrations, by now we don't use antibiotics. If we see beforehand that the SAA is elevated, and we know that the temperature is not always reliable, if the SAA is elevated and we cut off by 50, then we will try to postpone the surgery, because we know with the stress the likeliness of an infection coming up is higher. Now if it is 0, then we just go ahead and do the surgery, and we monitor afterwards. If a fever or if a horse is a little bit down after the surgery, we just monitor the SAA and only step in with antibiotics if we do see it just flip up really high. The other point is, for example, after fractures, if we have to put a cast on, we just monitor also by the SAA if anything goes wrong, if they're not weight-bearing as well, or if they, after 8 days, you think something might be going on underneath the cast, we monitor that with SAA as well, just to check if an infection comes up.
And you mentioned 50 as your pre-surgical cutoff. How did you get to that point?
It's a finger in the wind. It's a trial. I'll be happy to find out if anybody else say you have to wait until 0. But so far we've run well with that.
For me, I have 2 clients. I have 2 types of clients now. I have guys that SAA is the first words that they say to me when they see a horse, instead of just giving me antibiotics, doc. Or the ones that don't know anything about it. And just before I left, I had a new client, and he understood it pretty regularly. He let me pull it and then I explained it to him later. But he was quickly on board, actually. The value relative to a CBC is, I mean, if I said I'm going to prevent you guys from using SA for the next 6 months, would you be comfortable? I don't think so. Don't take my SAA. So that's kind of where I am right now with it.
well, and explaining one value to a client as opposed to trying to elaborate on a CBC and a fibrinogen, you've lost them. A lot of them they're maybe caught up in what else is going on with the horse. One single value is very simple to understand. It's obviously very powerful for us, so it's very easy to pass that on. to the client.
And 0 is normal, so that's good.
Yeah,
Well,
especially when
except in
it's
foals.
especially when it's a high value.
Yeah.
It really resonates with the client when I tell them it's greater than 3,000. It should be less than 20.
That's great. Like last year, I mean, I learned a lot, and I wanted to thank everybody. This has been really good.
Thank you.
And we'll see you next year.